Cramps that knock you out for days, that's not normal. Could it be endometriosis? You don't know, but I do. Hi, I'm your local OBGYN. I love women and let's talk about it. So, normal cramps are annoying. We're not saying anything different than that, but they should not be debilitating where they knock you off of your daily routine significantly. And that's where this becomes more of a problem and a conversation to seek help for. Normal period and normal discomfort. What is it? So, what you should expect with normal periods is that it starts with the bleeding or maybe a day or so before you start to bleed. It can be like pressure and cramps that's usually relieved with over-the-counter medications like Motrin or NSAIDs. When the bleeding starts, it usually starts to let up a little bit at that point. It should not be debilitating where it is taking you out of your daily activities. Overall, you feel like a relatively grumpy, normal human being when it's going on. But endometriosis is a different beast with a different set of characteristics. Pain usually starts up to a week before your periods, sometimes even a little bit more, stays on through until the cycle kind of gets going. It can get worse with intercourse, bowel movements, urination, and certain activities. It's not relieved with your over-the-counter meds like Motrin or NSAIDs. It can be fatigue, nausea, bloating, and a lot of difficulty getting pregnant when you're actually starting to try. The cause of this is endometrial cells, which is the inside lining of your uterus getting planted outside where it's supposed to be. And it's going to cause pain, little bits of bleeding and inflammation in those sites that it lands to, which is why it can make the insides a total mess month to month. There are a ton of options to consider in order to treat this. They're easy over-the-counter meds, some are prescription meds, some women end up with surgeries, but I'll tell you, in even the span of my career, the meds have gotten like really sophisticated in being able to target your discomfort. So it is definitely something to go in and talk about because the end result is not just surgery, surgery, surgery. Painful periods, common. Pain that is ruining your life for days on end, not. If you can't get help with the first gynecologist you see, come see your local OBGYN and get a second opinion because it's time to feel better.